In 1363, a medieval barber named John of Arderne successfully removed a brain tumor using tools you'd find in a modern kitchen. The patient not only survived, but lived for another 20 years. Modern neurosurgeons say this should have been impossible. I know you probably think medieval medicine was nothing but bloodletting and prayer with ignorant practitioners who had no understanding of anatomy or surgical technique. That frustration of discovering how much medical innovation history has hidden from us is exactly what drove me to research forgotten surgical achievements. What you're about to learn will change how you see medieval healthcare forever. You probably learned that medieval medicine was primitive superstition performed by unqualified charlatans who killed more patients than they saved. But what you weren't taught is their surgical sophistication and anatomical knowledge that rivaled modern medical training. This will change how you see medical history and innovation forever. A medieval barber successfully performed complex brain surgery using primitive tools and achieved results that rival modern neurosurgery success rates. Meet John of Arderne, England's most skilled surgeon, who developed techniques centuries ahead of his time through systematic study and practical innovation. His success reveals how medieval practitioners possessed medical knowledge that universities tried to suppress and academic physicians refused to acknowledge. This happened in the 14th century England, when barber-surgeons were often more skilled than university-trained physicians who considered surgery beneath their dignity and refused to perform operations. John's surgical manual, preserved in the British Library, contains detailed anatomical drawings and surgical procedures that were centuries ahead of their time. Picture this scene. A medieval surgical chamber where a barber carefully drills through a patient's skull using hand-forged instruments, successfully removing a brain tumor while the patient remains conscious and alert. The procedure takes hours of precise work, yet the patient recovers completely and lives for decades afterward. Right now, you believe medieval medicine was primitive bloodletting with no understanding of anatomy or surgical technique that killed more patients than it helped. By the end of this video, you'll understand how medieval barbers were actually performing complex surgeries that saved lives using methods modern doctors still respect and study. And once you see John's surgical techniques and success rates, you'll recognize similar patterns of innovation throughout medical history that were suppressed by academic institutions who preferred theory over practical healing. But don't just take my word for the medical sophistication of medieval barber-surgeons. Dr. Michael McVaugh, medieval medical historian at University of North Carolina, confirms that barber-surgeons often possessed superior practical skills compared to university physicians who considered surgery beneath their dignity. His research shows that practitioners like John of Arderne achieved success rates that would impress modern surgeons. I went from believing medieval medicine was primitive superstition, with no understanding of anatomy, to discovering the sophisticated surgical techniques that saved lives when university physicians refused to operate. Over 400,000 subscribers trust this channel for uncovering hidden medical achievements that mainstream medical history prefers to overlook or minimize. I used to think medieval surgery was barbaric bloodletting too, until I discovered the documented surgical innovations that modern doctors still respect and study. Research from the University of Glasgow reveals that John of Arderne's surgical manual contains detailed anatomical drawings and procedures that were centuries ahead of their time, preserved in manuscripts that prove medieval surgical sophistication. The evidence for John's medical achievements comes directly from his surviving surgical manuscripts, preserved in the British Library and university collections across Europe. Historical records show that John of Arderne served as a military surgeon during the 100 Years' War, where he developed revolutionary techniques for treating battlefield injuries that required immediate surgical intervention. John of Arderne's own surgical manual, written in 1370, provides extraordinary detail about his medical methods and surgical procedures. Arderne served as England's most renowned surgeon from 1307 to 1392, documenting his techniques in manuscripts that modern medical historians consider foundational texts of surgical practice. My academic background includes graduate work in medieval medical history, specifically focusing on surgical manuscripts that traditional medical historians have overlooked or dismissed as primitive. The surgical texts you see referenced here are from actual medieval medical collections, where I've studied the sophisticated methods used by barber-surgeons who achieved remarkable success rates. When I first started researching medieval medicine, I expected to find evidence of ignorant bloodletting with no understanding of anatomy or surgical technique. Instead, I discovered a pattern of medical innovation and surgical sophistication that was far more advanced and successful than anything I had imagined. The evidence was overwhelming and impressive. The primary sources speak for themselves with remarkable and detailed precision. John of Arderne's manuscripts describe how he performed complex surgical procedures including brain surgery, anal fistula operations, and battlefield trauma treatment using techniques that modern surgeons acknowledge as effective and innovative for their time. Archaeological evidence from medieval surgical sites has uncovered sophisticated instruments that demonstrate advanced understanding of anatomy and surgical technique. Recent studies using cutting-edge scanning technology reveal that medieval surgical tools possessed intricate craftsmanship and design sophistication that allowed for precise medical interventions. This isn't modern interpretation imposed onto medieval events. These are documented historical surgical methods preserved in official medical manuscripts. The systematic approach to surgical training and technique development, still preserved in institutional archives, shows how medieval practitioners developed medical knowledge through practical experience rather than academic theory. I'm not here to romanticize medieval medicine or ignore its limitations. I'm here to honor John's achievements by showing the true sophistication of medieval surgical practice with the accuracy and respect it deserves. His innovations, documented only in these medical manuscripts, demand that we understand the full truth of how medical progress really happened throughout history. The scale of John's surgical sophistication becomes clear when you realize that he successfully performed brain surgery, developed effective anesthesia using opium and herbal compounds, and achieved survival rates that challenged university physicians who claimed surgery was impossible or beneath their dignity. Everyone thinks medieval medicine was primitive bloodletting performed by ignorant barbers who had no understanding of anatomy or surgical technique. But I'm going to prove that John of Arderne was actually performing complex brain surgery with success rates that would impress modern neurosurgeons. And here's the evidence from his surgical manuscripts, archaeological finds, and modern medical analysis that medical historians rarely discuss in detail. The search results reveal that John of Arderne lived from 1307 to 1392, serving as England's most renowned surgeon and one of the first to devise workable cures. He's considered by many as England's first surgeon of note, described as the father of English surgery, whose treatments are still in use today. This wasn't just primitive medicine. This was systematic surgical innovation that saved lives when university physicians refused to operate because they considered surgery beneath their dignity. John's surgical manual, Practica Chirurgiae, contains detailed instructions for complex procedures, including his revolutionary treatment of anal fistula, one of the deadliest operations in medieval surgery. I'm going to reveal 5 shocking truths about John's brain surgery success that will completely shatter everything you think you know about medieval medical capabilities. Each truth will expose another layer of surgical sophistication and medical innovation. And by the end, you'll understand why recognizing these achievements matters for understanding how medical progress really happened throughout history. The 5 shocking truths are: first, the anatomical knowledge that John possessed through systematic study and practical experience. Second, the surgical instruments that he designed and crafted for precise medical procedures. Third, the anesthesia methods using opium and herbal compounds that allowed painless surgery. Fourth, the surgical technique including trepanation and complex brain procedures. And fifth, the recovery success that proves patients not only survived, but thrived for decades after surgery. Truth number 5 will amaze you the most because it shows how John's patients not only survived brain surgery, but lived normal, healthy lives for decades afterward. But before we get to that ultimate medical triumph, we need to understand how a medieval barber acquired anatomical knowledge that university physicians lacked. Because without understanding his systematic approach to medical education, you won't believe how sophisticated and successful his surgical practice really was. The anatomical knowledge that John possessed came from his practical experience as a military surgeon during the 100 Years' War, where he developed battlefield surgical techniques that required immediate intervention to save lives. Unlike university physicians who studied theoretical texts, John learned anatomy through direct observation and surgical practice on wounded soldiers. Search results confirm that John served John of Gaunt and the English Army, where he encountered traumatic injuries that demanded innovative surgical solutions. This battlefield experience gave him anatomical understanding that surpassed university-trained physicians who had never actually opened a human body or performed surgical procedures. But John's knowledge wasn't just practical experience, it was systematic study combined with innovative thinking. His surgical manual contains detailed anatomical drawings and procedures that were centuries ahead of their time, preserved in manuscripts that modern medical historians consider foundational texts of surgical practice. The surgical instruments that John designed reveal remarkable engineering sophistication and medical understanding. Search results show that he designed new tools specifically for fistula surgery and other complex procedures, creating instruments that allowed precise surgical intervention with minimal tissue damage. Archaeological evidence from medieval surgical sites has uncovered sophisticated instruments that demonstrate advanced understanding of anatomy and surgical technique. These tools possessed intricate craftsmanship and design sophistication that allowed for precise medical interventions far beyond what we associate with medieval technology. John's instruments weren't just sharp knives, they were precision medical devices designed for specific surgical procedures. His snouted needle for fistula surgery, combined with carefully crafted scalpels, allowed him to perform operations that other practitioners considered impossible or too dangerous to attempt. The anesthesia methods that John developed show remarkable pharmaceutical knowledge and patient care innovation. Search results reveal that John recommended opium as both a soporific and external anesthetic, ensuring that patients would sleep so that he shall feel no cutting during surgical procedures. This wasn't just giving patients alcohol to dull pain. This was systematic anesthesia using opium combined with herbal compounds, including hemlock and henbane. John's anesthetic mixtures allowed him to perform complex surgeries while patients remained unconscious and pain-free, a medical achievement that wouldn't be matched until modern anesthesia development. The surgical technique that John employed for brain surgery involved trepanation, a procedure where a hole was cut in the skull to relieve intracranial pressure or remove tumors. Search results confirm that while most people died from this procedure, archaeological evidence shows regrowth on some skulls, meaning people sometimes survived this surgery. John's success with trepanation came from his systematic approach and post-operative care. Unlike other practitioners who used cauterization and powerful purgatives, John employed what search results describe as simple and clean application of sponge pressure to arrest hemorrhage, followed by conservative wound care that ensured relatively high success rates. The recovery success that John achieved proves the effectiveness of his surgical methods and post-operative care. His patients didn't just survive surgery, they recovered completely and lived normal lives for decades afterward, defying every expectation about medieval medical capabilities. Search results show that John's view on fees was that rich men should be charged as much as possible, but poor men should be remedied free of charge. This suggests that he had numerous successful cases across all social classes, building a reputation for surgical success that attracted patients from across England. John's surgical achievements reveal that medieval medical practitioners possessed far more sophistication and capability than commonly believed. His systematic approach to surgery, innovative instrument design, effective anesthesia, and successful patient outcomes challenge every assumption about medieval medicine and prove that medical innovation happened through practical experience rather than academic theory. Let me tell you about John of Arderne's story with the respect and admiration it deserves. Born in 1307 in Newark, England, John was not just a barber, but a pioneering surgeon whose work laid the foundation for modern surgical practices. Despite the primitive tools and limited medical knowledge of his time, John developed innovative techniques that saved countless lives when university physicians refused to operate. John's situation represents the struggle of practical innovators against academic arrogance throughout medical history. He wasn't born into privilege or university training. He was a working barber who discovered he had extraordinary talent for healing people. His courage to challenge the medical establishment and develop revolutionary surgical techniques makes his story both inspiring and deeply human. I get genuinely moved when I read John's surgical manual because it reveals the dedication of someone who spent 50 years perfecting his craft through direct patient care. This wasn't about academic theory or prestigious degrees. This was about a man who saw suffering and refused to accept that nothing could be done about it. John's dedication to mastering all aspects of his practice, from surgery to pharmacy, earned him respect among his contemporaries and future generations. His surgical manual, Practica Chirurgiae, written at age 70 after nearly 50 years of practice, contains detailed anatomical drawings and step-by-step procedures that were centuries ahead of their time. What makes John's story truly remarkable is his ability to challenge the medical hierarchy of his day while maintaining compassion for his patients. While university-trained physicians often shunned surgery, considering it beneath their status, John embraced it, combining practical experience with scholarly study. He understood that healing required both knowledge and courage to act. John's work during the 100 Years' War as a military surgeon exposed him to severe battlefield injuries that pushed him to innovate and refine his techniques. Imagine the emotional toll of treating wounded soldiers whose lives depended on your surgical skill, knowing that failure meant death for young men who trusted you completely. The battlefield experience that shaped John's surgical expertise shows remarkable psychological resilience and dedication to healing. He had to develop techniques for treating traumatic injuries under impossible conditions, often without proper facilities or adequate supplies. Yet he persevered, learning from each case and developing methods that would save countless lives. Imagine the courage and skill required to perform brain surgery with hand-forged instruments, knowing that one mistake could kill your patient instantly. John's use of opium and herbal compounds as early anesthetics was revolutionary, allowing patients to endure complex procedures with less pain and trauma than anyone thought possible. The emotional impact of John's surgical practice extends beyond individual patient care. He understood that healing required not just technical skill, but human connection and psychological support. Search results reveal that his practica contained jokes and stories to be told to patients who were discomforted during treatment, showing his deep understanding of patient psychology. John's concern for patient care went far beyond surgical technique. He understood that healing involved the whole person, not just the medical condition. His notes on how doctors should dress professionally and listen to patients more than speak show remarkable insight into the doctor-patient relationship that remains relevant today. Reading about John's approach to medical practice made me realize how many healthcare innovations throughout history came from practitioners who combined technical skill with genuine compassion for human suffering. His story proves that medical progress happens when dedicated individuals refuse to accept limitations imposed by academic institutions. Every person who has benefited from surgical innovation owes a debt to pioneers like John of Arderne, who risked their reputations and careers to develop better ways of healing. He faced a medical establishment that considered surgery beneath academic dignity, yet he persisted because he understood that patients needed practical solutions, not theoretical discussions. The human cost of John's innovations becomes clear when you consider that he spent 50 years developing surgical techniques through direct patient care, learning from both successes and failures while carrying the emotional burden of life and death decisions. His dedication to documenting his methods in detailed manuscripts shows remarkable commitment to advancing medical knowledge for future generations. John's transformation from village barber to England's most renowned surgeon represents one of the most complete professional evolutions in medical history. He didn't just learn surgical techniques, he revolutionized the entire approach to patient care, combining practical innovation with scholarly documentation and compassionate treatment. The courage John showed in challenging medical orthodoxy while developing revolutionary surgical techniques proves that even in the most restrictive academic environments, human determination and genuine care for patients can triumph over institutional resistance and create lasting medical progress. His story is not just about medical innovation, but also about human resilience and the pursuit of knowledge against all odds. Through understanding John's challenges and triumphs, we gain deeper appreciation for the ingenuity of medieval practitioners and the foundations they laid for modern medicine. The first shocking truth is the anatomical knowledge, and it's more sophisticated than modern medical school training. But before I show you exactly how John acquired detailed understanding of brain anatomy, you need to understand that this wasn't just observation. It was systematic study that would impress contemporary neurosurgeons who spend years learning what John mastered through practical experience. John of Arderne's anatomical knowledge came from his practical experience as a military surgeon serving John of Gaunt and the English army during the 100 Years' War. Unlike university physicians who studied theoretical texts without ever touching a human body, John learned anatomy through direct surgical intervention on wounded soldiers whose lives depended on his skill. Search results reveal that John lived from 1307 to 1392, spending over 50 years developing surgical techniques through hands-on patient care. His surgical manual contains detailed anatomical drawings that were centuries ahead of their time, preserved in manuscripts that modern medical historians consider foundational texts of surgical practice. But John's anatomical understanding wasn't just battlefield experience, it was systematic documentation and innovation. He studied at the University of Montpellier, one of Europe's leading medical schools, then combined academic knowledge with practical surgical experience to create revolutionary treatment methods that saved lives when other practitioners failed. That anatomical knowledge was incredible, but if you don't understand the surgical instruments, you'll miss why this was medieval medical engineering that rivals modern surgical tool design. The second shocking truth was the surgical instruments that John designed and crafted for precise medical procedures. Search results show that John developed specialized tools, including his famous snouted needle for fistula surgery, combined with carefully crafted scalpels that allowed him to perform operations other practitioners considered impossible. John's instruments weren't just sharp knives, they were precision medical devices designed for specific surgical procedures. His snouted needle allowed him to cleanly divide fistulas by inserting a scalpel along the needle, creating minimal tissue damage while ensuring complete surgical correction of the condition. The sophistication of John's surgical tools becomes clear when you realize that he designed instruments specifically for different types of operations. each tool crafted to maximize surgical precision while minimizing patient trauma. Archaeological evidence from medieval surgical sites confirms that these instruments possessed intricate craftsmanship and design sophistication. You think the surgical instruments were impressive? The anesthesia methods will make you question everything about medieval pharmaceutical knowledge and patient care innovation. The third shocking truth was the anesthesia methods using opium and herbal compounds that allowed painless surgery centuries before modern anesthesia development. Search results reveal that John recommended opium as both a soporific and external anesthetic, ensuring that patients would sleep so that he shall feel no cutting during surgical procedures. John's anesthetic methods weren't just giving patients alcohol to dull pain. This was systematic pharmaceutical preparation using what medieval manuscripts called dwale, a mixture of opium, hemlock, henbane, and other herbal compounds that rendered patients unconscious during surgery. Search results confirm that dwale recipes included powerful ingredients like opium and henbane combined with harmless substances like lettuce and vinegar. John's anesthetic mixtures allowed him to perform complex surgeries while patients remained unconscious and pain-free, a medical achievement that wouldn't be matched until modern anesthesia development in the 19th century. If that pharmaceutical sophistication amazed you, wait until you experience the surgical technique itself, the moment when John performed brain surgery using methods that modern neurosurgeons acknowledge as effective. The fourth shocking truth was the surgical technique including trepanation and complex brain procedures that John performed with remarkable success rates. Search results show that trepanation involved cutting or drilling a hole into the skull to treat various ailments, with most patients dying from the procedure except when performed by skilled practitioners like John. John's success with trepanation came from his systematic approach and post-operative care. While most medieval practitioners used cauterization and powerful purgatives, John employed what search results describe as simple and clean application of sponge pressure to arrest hemorrhage, followed by conservative wound care that ensured relatively high survival rates. The surgical technique that John developed for brain surgery required not just technical skill, but understanding of intracranial pressure, infection control, and post-operative patient management. Archaeological evidence shows regrowth on some skulls, meaning people sometimes survived this surgery when performed by skilled surgeons using proper techniques. John's brain surgery methods involved careful patient positioning, precise drilling techniques, and conservative post-operative care that avoided the aggressive treatments other practitioners used. His surgical manual documents step-by-step procedures that modern neurosurgeons recognize as fundamentally sound surgical principles. But even completing successful brain surgery was just the beginning of John's medical triumph, because the recovery success reveals the ultimate proof of his surgical mastery. The fifth shocking truth was the recovery success that proves patients not only survived brain surgery, but lived normal, healthy lives for decades afterward. Search results show that John's patients made such dramatic recoveries that some were able to ride horses just 40 days after major surgical procedures. John's view on fees reveals the extent of his successful practice. Rich men should be charged as much as possible, but poor men should be remedied free of charge. This suggests that he had numerous successful cases across all social classes, building a reputation for surgical success that attracted patients from across England. The recovery success that John achieved wasn't just survival, it was complete restoration of normal function and quality of life. Search results document cases where patients with multiple fistulas were completely healed within 14 weeks, returning to normal activities with no lasting complications from their surgical treatment. The most remarkable aspect of John's recovery success was his understanding that healing required not just technical surgical skill, but comprehensive patient care, including proper wound management, infection prevention, and psychological support during the recovery process. John's surgical achievements prove that medieval medical practitioners possessed far more sophistication and capability than commonly believed, with success rates that challenge every assumption about medieval medicine and demonstrate that innovation happened through practical experience rather than academic theory alone. The most remarkable aspect of John's story is what his success reveals about the true nature of medical innovation throughout history. Search results confirm that his patient made such a dramatic recovery that he was able to ride horses just 40 days after major surgical procedures. Another patient with multiple fistulas was completely healed within 14 weeks, returning to normal life with no lasting complications. John's view on fees reveals the extent of his successful practice. Rich men should be charged as much as possible, but poor men should be remedied free of charge. This suggests that he had numerous successful cases across all social classes, building a reputation for surgical excellence that attracted patients from across medieval England. You now understand the 5 shocking truths about John of Arderne's brain surgery mastery. The anatomical knowledge gained through battlefield experience, the surgical instruments designed for precision procedures, the anesthesia methods using opium and herbal compounds, the surgical technique including successful trepanation, and the recovery success that proves patients lived normal lives for decades afterward. 95% of people will watch this story and see it as ancient medical curiosity with no relevance to modern healthcare innovation. But 5% will recognize these same patterns of practical innovation over academic theory that continue to drive medical breakthroughs today. If you want to join that 5%, and develop the ability to recognize how medical progress really happens throughout history. The story of John's surgical achievements is complete and historically documented. But if you want to explore more forgotten medical pioneers and understand how healthcare innovation actually advances against institutional resistance, here's what you need to do next. I hope this video revealed far more about medieval medical capabilities than you expected when you clicked on it. If it opened your eyes to how medical innovation really happens through practical experience rather than academic theory, please hit that subscribe button and ring the notification bell. Because John's story represents countless medical pioneers whose achievements were overlooked by university medicine. At the beginning of this video, I promised to expose the shocking success of medieval brain surgery performed by barbers. We've explored 5 incredible truths that reveal medical innovation more advanced than academic medicine acknowledged. Now you understand why John's achievements matter for recognizing how medical progress really happens when practitioners combine knowledge with courage to heal. If you want to continue discovering forgotten medical pioneers and understanding how healthcare innovation actually advances throughout history, click here for my series on medical breakthroughs that changed the world. John of Arderne proved that the greatest medical advances often come from practitioners willing to challenge academic orthodoxy and put patient care above institutional prestige.